from the back of the room and find a seat. We will have everybody settled by kickoff.1 minute? You have 1 minute to get comfortable. I feel like I'm ready to list that. I'm good? Okay. Well, good morning, everybody. Thank you all for being here. I'm Julia Lear. I chair the Cochs Advisory Board. We've been talking about this meeting for a year, and we're so delighted to have you with us and look forward to a day of enormously exciting ideas, conversation, and wrestling with tough issues. Welcome to Exploring Health Reform and Criminal Justice, Rethinking Connections Between Jails and Community Health. You know, as I look around the room, and I'm sure some of you have done the same, I'm struck by the diversity of the leaders from the various worlds represented here: policy, community health, corrections, philanthropy, and they're probably the odd one and two of many other communities that will contribute to the conversation. The fact that you are here speaks to how critical this topic is and how important it is that we figure out how to strengthen and leverage the connection between public safety and public health. For many people, this connection may not be obvious, but the fact is that jails are important providers of healthcare services to the high-risk population that is generally underserved in its initial community. Jails are required by law to provide appropriate health care to people in their custody. And so we as a society, though not necessarily fully aware of it, already make enormous investments in local correctional health care. And the issue is, how can we do this better? Unfortunately, that investment is frequently lost or much degraded as soon as people leave jail because of the lack of connection and connectivity between jail and local community to which the detainees are returning. This is a population that we know is at high risk for mental health, substance abuse issues, and a host of contagious and chronic diseases. When detainees are released back into their home communities, they bring those problems with them. Lack of a plan or some kind of structure to continuing the health care that they receive in jails results inevitably in those problems reemerging, continuing on. Problems can worsen, health status can degrade, frequently leading to the cycle again of arrest, reincarceration, and then we have not only health problems, but again an enlarged public safety problem. I want to be explicit and hope you take in this one point in particular. We did not organize this meeting as an opportunity to either promote or criticize the Affordable Care Act. Instead, our perspective here is that health reform opens the door to a new opportunity to examine the connections between community and correctional health. And by bringing together all of you who are in this room and the many more who are joining us by webcast, we can perhaps generate the kinds of ideas that move this field forward, this joint field of corrections and public health. Today is a truly exciting opportunity to make real difference in the health and safety of our communities. Our panel discussion this afternoon, are centered on the 4 background papers that I hope everybody received. If you don't have them, see the staff in the back. They are truly wonderful set of papers, and we will mine them for what they have in our panels. We're going to begin with an overview. That will be followed by remarks by Assistant Attorney General Lori Robinson, and then we proceed to panel discussions of the paper. We have allotted time for Q&A. The Cochs staff will wander around among you with microphones, but we'll also have cards. You can write your questions down, and they'll get handed to the moderators. A couple more things before we get started. The bathrooms are out the back, down the steps, and around the corner, but inside that door you came in, so easily accessible. Cell phones. Would you take a moment now? We've built this into the calendar. Take a moment now, check, make sure it's either on vibrate or turned off. We would greatly appreciate that. As I mentioned earlier, the meeting is being webcast, so the organizers of this session have made every effort to make sure that the energy that is being invested in this topic is shared with as many people as possible, and I'm sure it will be archived so that if you want to return and relook at some of the talks that you heard, that will be available to you. Lunch is going to be held on the 2nd floor of the Thunder Grill, which you probably noticed. It's sort of parallel to us on the other side of the building, and you'll just go up steps inside that. You need your meeting badge to be admitted to lunch. So don't tuck it in your pocket and forget it, because we might not feed you. We are going to be as punctual as we can, so help us keep your questions succinct. Help us move this along, because we don't want anyone to miss a plane at the end of the day. Again, thank you so much for joining us. We're looking forward to this discussion. And now it's my pleasure to introduce Nancy Barron from the Robert Wood Johnson Foundation, where she is Senior Advisor for Development, who has been truly with Steve the inspiration for this day.
Thank you, Julia. Good morning and welcome. On behalf of the Robert Wood Johnson Foundation, thank you everybody for coming. The mission of the Robert Wood Johnson Foundation is to improve health and health care of all Americans. Many of our programs focused on the highest risk, hardest to reach populations. One such program is Cochs, Community-Oriented Correctional Health Services, your host for this meeting, which RWJF is sponsoring along with the Langeloff Foundation. Cochs was established to build partnerships between jails and community health care providers. It is based on the model in Springfield, Massachusetts, where Dr. Conklin in the early 80s was treating patients for HIV/AIDS in the local health care center when he noticed that some of his patients were not returning for their medications. He tracked them down in the community, only to learn that they were in jail. He went to the jail and told the sheriff that he had his patients. The sheriff replied that they were his inmates. They negotiated, and Dr. Conklin got access to treat his patients in the jail. Over time, Dr. Conklin created a health center in the jail, partnering with 3 other federally qualified health centers in the community where the majority of these detainees would return. A simple, common sense approach that had significant implications for improving health, for connecting these detainees back to the community, and for eventually helping to contribute to reducing recidivism. We invested in Cochs to replicate this concept of connectivity between jails, the public health system, and the healthcare safety net because we realize that jails need to be seen as part of the safety net for two reasons that you will probably hear echoed throughout this meeting. First, a significant number of the highest risk, hardest to reach populations cycle through our jails each year. Second, because jails are located in the community, they can serve as a very important leverage point for accessing services. I'm excited about the discussion today and hope that we can keep it going long after this conference. Again, on behalf of the Robert Wood Johnson Foundation and my colleague Scott Moyer, president of the Langelock Foundation, who will be joining us soon, thank you for coming. And now I'd like to turn it over to Mike Du Bois, CEO of Cochs.